All right. Good morning, everybody. Dr. Rafich here from Vet Triage. Wednesday, October 30, 2024, 8:02 a.m. Pacific time. We are going through this issue of JAVMA, which is May 15, 2018. And we're going to be talking about this paper, which is what is your neurologic diagnosis? And this is actually done by Dr. Wagner and Dr. Williamson from Metropolitan Veterinary Hospital in Ohio, as well as the Neurology Service in Cornell. And Dr. Williamson's one of my good friends, and we work together in New York. So very cool. Congrats to her for publishing his paper. So let's go through first the introduction. This is a 10-year-old male West Highland White Terrier that had a current vaccination status. The dog was referred from the general practitioner for acute progressive tetraparesis. Initially, the dog had been intermittently frantically scratching over its face over a 2-day period. And then 2 days after that examination, the dog became acutely paraparetic with hyperreflexive patellar reflexes. So acute meaning happening immediately, usually on the frame of hours, but typically probably less than 7 days, but hours are what we typically mean. Hyperreflexive means that the reflexes in the dog's limbs were very spastic when you tested them. So if a normal reflex is like that, this was like really exaggerated. And then patellar is the kneecap, and so that's one area in the body that we test for reflexes. 12 hours after that, spinal reflexes were absent in the pelvic limbs and decreased in the right thoracic limb. Deep pain cessation was intact in all 4 legs. After 72 hours, the dog became tetraparetic. So before, it was acute paraparesis, which means weakness of the hind limbs, para being hind limbs or pelvic limbs in dogs. Now the dog is tetraparetic, meaning that is weak, so paretic in all 4 limbs, which is tetra. The referring veterinarian administered carprofen, which is a nonsteroidal anti-inflammatory, buprenorphine, which is an opioid for analgesia, and doxycycline, which is a antibiotic that we typically use for tick infections as well as other infections. On the neurologic examination, the dog was determined to have a non-ambulatory flaccid tetraparesis with an inability to right himself from lateral recumbency, but able to maintain sternal recumbency after positioning. So lateral recumbency is when a dog is on its side. Sternal recumbency is when it's sitting on his chest. Non-ambulatory means he's not able to walk in all 4 legs. Flaccid meaning he's got no tone to his limbs, spaghetti arms. And tetraparesis we already talked about. They also found a decrease in the menace response with vision, and the pupils also were decreased. Gag reflex was decreased, and the palpebral reflex was decreased. So the pupils of both eyes were myotic and constricted to pinpoint size. So there's 2 reasons for having a decreased menace. Menace is when if you pretend to strike an animal to its face, it should blink, and it should theoretically turn away. So that'll cause a menace response. A menace means a blinking reflex. However, if the dog is blind or cannot move the muscles of the eyelids, then it'll have a negative menace reflex. And so that's what this tells you here. And the decrease in gag reflex and decrease in palpebral reflex, which is when you touch the eyelids and they blink, those were also decreased. That indicates usually a cranial nerve issue. So the next page is, what is your diagnosis? So what initially got me with this, I thought that this was going to be a lower motor neuron disease, but then the cranial nerve deficits, which is the gag reflex, the palpebral reflex, the weakened menace confused me. And I thought maybe it's multifocal, or maybe it's actually a caudal cerebrum. But actually the diagnosis was a diffuse neuropathy or myopathy or neuromuscular junctionopathy, indicating diffuse lower motor neuron disease. So apparently the cranial nerves can be affected with lower motor neuron disease. I definitely forgot that, so this is a very cool case. So anytime you have a dog that's got hyporeflexia, so decreased reflexes, hypotonia, so decreased tones to the limbs, flaccid tone to the limbs, and possibly some interaction of cranial nerves, you're thinking lower motor neuron, which is different than central nervous system. So you're not thinking brain, you're not thinking spinal cord, you're thinking either the nerve roots that leave the spinal cord and go down to the muscles, or you're thinking there's a problem with the muscles themselves, or you're thinking there's a problem between the junction of where the nerves interact with the muscles to help facilitate muscle contraction. Those are your three areas that are affected when you have a diffuse lower motor neuron disease. And diffuse is important too. Diffuse means the entire body is affected, whereas if you had more focal lower motor neuron disease like megaesophagus, that does not have to have a systemic manifestation to it. Okay, etiology. So this may be due to infection, usually tick paralysis or botulism. This could be autoimmune or inflammatory, such as polyradiculoneuritis or acquired fulminant myasthenia gravis. This could be metabolic disease like hypoadrenocorticism or hypothyroidism, and it could be cancer like lymphoma. Botulism is an infectious disease caused by Clostridium. It's usually when animals eat a cadaver, especially like a bird cadaver. Tick paralysis we're going to go through now. Polyradiculoneuritis is coonhound paralysis. Acquired fulminant myasthenia gravis. So I'd mentioned before focal lower motor neuron disease being like megaesophagus. Megaesophagus can be manifestation of focal myasthenia gravis, which is the name of a neuromuscular condition. If you have fulminant myasthenia gravis, that affects the whole body. Metabolic disorders like hypoadrenocorticism, that's also Addison's disease. It's when the body is making less cortisol than expected, or hypothyroidism, which is when the body is making low thyroid. So flea and tick prevention was given to this dog topically, and also this dog received Benadryl in preparation for receiving human immunoglobulin. Immunoglobulin is used as empirical treatment for polyradiculoneuritis. They conducted a complete blood count. CBC would show a mild anemia. Serum biochemistry panel was normal, but then later on showed mild hypokalemia, so low potassium. Right lateral thoracic radiograph was normal. They searched the body for ticks. They couldn't find any, but then 6 hours after referral, they did find an engorged tick on the dog's mandible, and they removed it. The dog improved hours later. The tick was identified as Dermacenter variabilis, and tick paralysis was determined to be the diagnosis. So comments. At least 69 tick species are known to cause paralysis in many animals by producing a neurotoxin that interferes with either the propagation of impulses along motor neuron axons or with acetylcholine release at neuromuscular junctions. The neurotoxin is thought to affect both sensory and motor fibers. The exact nature is unknown, but it's produced by the tick's saliva and transferred to the host after attachment and engorgement. Signs develop only when an attached tick is fully engorged with blood, and most species will resolve after it's removed. It takes 5 to 9 days after tick attachment for the signs to be evident. These include acute, rapidly progressive flaccid paralysis with decreased to absent spinal reflexes. Tetraplegia develops within 12 to 72 hours. So paresis is a word we've been using here, or paretic, meaning weakness. Paralysis or plegia means paralysis. Additionally, cranial nerves 5, 7, 9, and 10 can be affected. And that's what confused me here. So that's very cool. Dysphonia, which is an abnormal vocalization. Facial paralysis, so paralysis of the facial muscles, which is probably why this dog had a negative menace. Dropped jaw, which means the jaw is just hanging there. And loss of facial and masticatory muscle control, meaning the ability to chew gets lost. So this may explain why the dog was scratching its face before presentation. He was trying to remove a tick off his face. The most commonly reported tick species that cause paralysis include Ixodes holocyclus, which is in Australia, Dermacenter androsdi, Dermacenter variabilis, and Argus radiatus, which is in North America, Ixodes rubiconudis, which is in South Africa, Rhicephalus evertsi, and Argus walkeri in Ethiopia, and Argus radiatus in the Nearctic region of North America. Along the east coast of Australia, about 20,000 domestic animals are affected each year, with signs more severe than those in North America. And with Vet Triage, we work in Australia, so we're fully aware that with tick paralysis in Australia, it's always an emergency, or tick bites rather, whereas tick bites in North America, usually not an emergency. These severe signs include acute central nervous system aberrations with respiratory failure and death occurring 1 to 2 days after onset if no treatment is provided. Although an antiserum is available, for severe cases of ixodes, holocyclus, anaphylactic reactions, meaning allergic reactions to this serum, may develop. You can prevent this by, or at least test for this by injecting a small dose under the skin of the dog and seeing if they develop a wheal or a hive. North American origin, the prognosis is good. If pressure sores are prevented, this is during paralysis, if you keep them hydrated, and if you continue with their nutrition, if you also prevent hypostatic or aspiration pneumonia. Clinical signs often resolve within 8 to 12 hours after removing the tick. Prevention of tick paralysis is the best method, and you use that through topical products. Episodes of tick paralysis in the past apparently make the dog more prone to tick paralysis in the future. Cases of tick paralysis in Australia and the Midwest and Western United States have been reported, but this is the first report of this occurring in the Northeastern United States. So this emphasizes a few things. Number one, the importance of the neurologic examination, remembering your fundamentals. Secondly, tick prevention, of course, is important. And so general practitioners out there ought to emphasize the importance of that. And then finally, ticks are spreading. We are seeing more and more ticks in areas of the United States that classically wouldn't have ticks. Even here in Nevada, we are seeing more ticks. And so they are spreading, maybe due to climate change. I don't know. But this is a very cool paper. And I look forward to seeing you guys tomorrow. Thanks for those who are watching the live stream. Take care.